Our chief medical officer here in Austin is joining a group of experts to help combat future pandemic threats. Dr. Mark Escott has been named one of the project leaders of the new UT Center for Pandemic Decision Science. And Dr. Escott is joining us today. Thank you so much and congratulations to you.
Thank you. It's a pleasure to be here.
So essentially, you all are tasked with building this roadmap to really help with pandemic decision making. What are some of the challenges, Dr. Escott, that you all, this new center, will focus on to really help combat what we saw at the peak of the pandemic back in 2020?
Well, the center is really focused around three questions. First, how do we best identify pathogens early that are emerging and detect them where they first emerge? The second issue is really how do we anticipate behavior of the community, of political leaders, and ultimately how do we bridge the science and the decision making together to ensure that we do a better job next time at our response.
And researching this new center, we see there are more than 40 different just scientists, engineers, clinicians, policymakers working together to launch the new center. So I understand there will be some pretty extensive work over the next 18 months, and some of that includes forecasting human health behaviors.
That's right. Part of the challenge with us during the COVID-19 pandemic was really predicting how people were going to respond to the threat. And ultimately, the risk-based staging that the city of Austin had turned out to work quite well. So using that as a model for us moving forward is what we'd like to do.
So the National Science Foundation selected the University of Texas at Austin for this pilot grant to establish the UT Center for Pandemic Decision Science. As you mentioned, you were on the forefront of the pandemic, and I know that a lot of things that were implemented within the city really shaped policy. Is that why they chose Austin to really pilot this program?
Well, I think that was certainly one of the contributing factors. We've been approached by a lot of groups about how we constructed that risk-based staging, which merged the science and the policy together. So I think there's a great deal of interest in how do we use that model at the state level, at the national level for future threats.
And what do you hope comes of all of this? Is there a timeline for when this will end, or is this an ongoing study?
This is an 18-month seed grant to build out these concepts with the ultimate goal of long-term funding of the center.
Okay, Dr. Mark Escott, thank you so much for joining us.
Thank you.